Namaskar everyone, and welcome you all in this series of acute management of acute diseases through homeopathic practice. This is my third video. First video was an introduction video, and the second video, part 1, was actually about the first fundamental principle that you have to remember in managing acute disease. And we talked in a brief about the causative modalities, the causative factors, and the importance of causative factors, how important it is and why it is so important, so that you have to look into the philosophical background behind managing an acute disease. If you're missing the cause, then it's very difficult to find the disease remedy. It becomes tough. But if you can find the cause, 80% of your remedy gets solved. Of course, you have to have your present predominant totality also and other characteristic individualizing symptoms. So now today, what is this session all about? What are we going to talk about? So my understanding and my experience in handling diseases and managing acute disease, people learn repertory. People learn how to take cases. Even they learn about Materia Medica and so much about the remedies also. Where does the difficulty come then? The difficulty actually comes not in repertorizing, not in finding or eliciting the symptoms. I think the difficulty most important comes in your understanding of Materia Medica. Whatever you do, whichever method you do, but ultimately you will have to select your drug, right? You have to give Penicillin, Rustox, Equinite based on your understanding. So in acute disease, what is the problem? We take symptoms, we repertorize, we sometimes look for causative modality also. And repertory shows Rustox covering every symptom, maximum symptom. That's what college days were taught to. They taught the same thing. You look for the remedies, which in repertory sheet covers the maximum rubrics. And you give the remedy. Patient does not get better. Has it happened with you? Anytime? With me? Many times. So this made me think, I started thinking about it, that where am I lacking? Where is the problem? I feel the remedy is right, but when I give, it doesn't work. Where am I missing it? And remember, my friends, in acute disease, as well in chronic, you don't get so much time. You might get 1 or 2 chance, maybe. After that, patient either will leave you, or you know what happens in acute disease. So now what is an important point which I want to emphasize is, actually we think we know Materia Medica, but the way we understand our drugs, there's a real problem. What am I going to talk about today is that the most important and the crucial part is to understand the remedies. There are just 10 or 20 remedies, 10 or 20 polycrest remedies or acute remedies, which you know properly. If you know properly, you can really help your patients. So I'm not going to elaborate on this topic, but yes, I'm going to give you short notices, short clips or short nuggets about how to remember a drug and how to read it, and when you open a remedy, what are you looking for in a remedy. Three people in my life I want to dedicate this video to, and it's about Materia Medica basically. So if you do not know the drugs, then it is very difficult to treat patients. So 3 people I want to dedicate is, number 1 is Dr. Sarkar, second is Dr. Dinesh Gupta, Inardev Gupta from Azamgarh. Dr. Sarkar you all know, Dr. Sunilmar Sarkar, Dr. Gupta from Azamgarh, and Dr. Gajanan Dhanepkar. What I learned from these 3 about Materia Medica. Sarkar sir, Dr. Sunilmar Sarkar sir always used to say, he was the first person who actually changed my perspective looking at the Materia Medica and towards the illnesses. He said me many years ago, Manish, whenever you're looking at the drugs, studying a drug, read a drug and tell yourself, find out in every remedy 5 or 10 bullet points, 5 or 10 characteristic points, which covers the general symptoms or the causative model, anything it could be, your best 5 or 10 points. And say to yourself that I will not prescribe this drug unless these symptoms I see. So most cardinal symptoms of a drug when you study, you note down and you keep it in your mind. And keep on reading, keep on reading, keep on reading. Those drugs will keep on coming. Those symptoms of the drugs will keep on coming. This is number one learning I got from my teacher, my mentor, Dr. Sarkar. Second is Dr. Dinesh Gupta sir from Azamgarh, UP. He was the person who actually, in a way, revolutionized my practice. I was managing acute and other things, but once I started learning from him, it really helped me. I can't tell you how much it helped me. What I learned from him is about the causative factor, the importance of causative factor, and the most important part, what he said, was the bolds and the italics. When I used to solve his cases, he used to tell me that, Manish, don't prescribe any remedy unless you have read the remedy in Allen's and Borax. At least in Allen's, at least in Borax, you have read it. Even if you know the remedy in and out, before prescribing, you have to open a drug and read a remedy. And I asked, what should I read in remedy? He said, first is the causative factor. Every remedy has got its own way of developing a symptom, number one. Second, the bolds and the italics, number two. And third, he said, whatever is the symptom of the patient has to be written in Materia Medica somewhere or the other. Whatever patient is saying, it has to be written. Once you find that, then only give the remedy. Otherwise, you give the remedy, but it's going to be tough. This was my second learning. And of course, the third and the most, one of the most important things which I learned, which I still am learning more and more, is from Dr. Gajanan Dhanipkar sir. He's the person who talks about pathophysiological connection. He's the person who actually is helping me right now. Also, he's helping. I'm still learning from him. I'm just, he's at 10th, 100th level and I'm like 1 level, but I'm learning from him. He's the person who taught me, who's teaching me that find out the pathophysiological connection. Once you get the cause, like suppose getting wet in rain, there are 10 remedies getting wet in rain. But after getting wet in rain, some remedy will have affection on the joints, some muscles, some glands, some blood, some brain, some tissues, some testicles, gonads, female, right? So pathophysiological connection. Go and find out the evolution of disease. Go back and find out how the disease started and trace the cause, the first physiological change that happened in the patient and the pathological change that you can see right now. Means before the pathology happened, what are the physiological changes? That's what I'm learning from. So these 3 pointers, and thanks to all my teachers, and this video is dedicated to, they have caused a lot of immense confidence in me to prescribe drugs and with very successful results. So now my friends, let's take up few of the remedies. I have noted down few remedies. Let me write down. Okay. Few remedies, let's write down. First is aconite. And what I will do is that I'm not here to teach you. People who are watching my videos, I know definitely that you all are very good homeopathic doctors. You're being trained very well. You have got a very good exposure that we had as compared to us. What I'm going to share you is that what I do in my practice and how do I keep up my how I keep myself updated. Aconite, Allen's Keynote. The first book that always has to be in your hand is Allen's Keynote, and then of course Boriki. Before we prescribe Allen's, let's talk about aconite. Now, when are you going to give aconite? Suppose you repertorize everything you do and you get aconite. Now, how do you remember aconite and when will you give aconite? So let's open. I'm purposely opening this book because the students who are looking at me, who are my students, who are getting impressed by me, I want to show them that there's no miracle, there is no big magic. We also learn from the books. We open the books in front. I open the book in front of patients because I want to give the right remedy. So it's not that I know everything, right? But when you open this Allen's Keynote, what are you looking for? So let's open aconite. Where is my aconite? Okay. People who are watching me, I want you also to open aconite. Aconite, yeah. The second paragraph. Let us please open aconite. Let's open second paragraph. What does he say? In Allen's Keynote, many places you will find out complaints begin from. You find in Carboveg, you find in Medurinum, you find in Rustox, everywhere, a lot of places it is written, Bryonia. This is the causative factor. And to give that remedy, what is written there has to match. Otherwise, your remedy is not going to act. So first thing what he writes down, complaints caused by exposure to dry cold wind or dry north or west winds. So italics, what is written is the most important thing, but even important than that is the italics. So first thing is dry and cold wind. Aconite patient will develop fever, joint pain, anything it can develop. The causative elements has to be he has gone out and he was exposed to what kind of air? Cold air. What kind of cold air? It is dry. Now you think, where do you get dry air? Now see, right now I am in Mumbai. This is mid-May. You might be seeing I am quite sweating, right? Because it's hot here. It's hot here. We go outside, it's so hot. It's not just hot. It is humid. I am also sweating outside. Everybody is sweating. Humid. Even if draft comes, Aconite is not going to be the remedy for this environment. Remember that. So think about the environment. So where patient went. That's why in the last video I was talking. Ask about the patient 1 week before, 3 days before, 4 days before. Where were you? Where you had gone? Where you traveled? He might be in Mumbai for consultation, but you will know that he traveled. He's coming from Delhi. He's coming from north. How was the climate there? It was sheer cold. Draft was coming. So dry, cold air, number one. Second is, he says, exposure to drafts of cold winds while perspiring. It is also kind of checked perspiration. It is written ahead also. Bad effects of checked perspiration. So patient, now you have to think in this term. This is how you remember a drug. You don't have to actually memorize a drug. You just have to visualize and remember a drug. There's a beautiful lecture of Allen's keynote, how to study Allen's keynote in YouTube. Somewhere somebody has uploaded my video. You can go and watch it. You know, it's not just promoting myself, but you can just go and watch it and you will understand how to understand Allen's keynote. It's about knowing the drug. So in your mind, you understand, you visualize. Okay, what does it mean? It means he's saying exposure to drafts of cold air while in perspiration means what? How will it happen? How will patient come? This is how you have to think. So, same thing, patient is coming out, it's cold environment or maybe hot environment also, it could be summer also, but there is a centralized AC. I went out, I'm sweating and suddenly I come and then draft of cold air comes. And suddenly my sweat gets checked, stopped. So again it is cold air, remember this, okay. As you go down, you will see certain places where it is written in bolds. So draft of cold air, there are so many remedies. There is not just Aconite, there are so many other remedies too. So to give Aconite, what is another qualifying symptom? Is the bolds. What is written there? It's just directly in the next line. Great fear and anxiety of mind. Now this is a remedy where you will find fear, fright, scariness and too much anxious. Patient is too much anxious. I will die, please save me, save me. It can look like arsenic sometimes. But it is of fear, fright, acute stage. And then you think of Aconite. And of course, I don't have to say that suddenness is an important thing. Next is, you always look for the relationship. Always look for the relationship. Aconite aggravation. Let's look at the Aconite aggravation. Now, definitely you can go and read all the remedies. Now, you can find after fright, all the bolds. You can just read the bolds and the italics. You will find fright, restlessness, tossing, agony, dry cold wind, drafts of air. This is the causative element. So you can help patient only when, with Aconite, only when you find the symptom. Otherwise, you can have a lot of theories, but it's not going to work. Evening, night pains are insupportable in warm room when rising from bed, lying on affected side. That's okay. Also, there's something very important in relationship. I'm teaching you actually Allen's keynote now. Okay, relationship. Once you give Aconite, you all know that Aconite is a superficial remedy. It might help, but what after that? So let's read. Complementary, it's coffea in fever, sleeplessness, intolerable pain. So he says if fever is there and a lot of pain is there, restlessness is there, then you can think of, after Aconite, you can think of coffea is a very good remedy. To arnica, it is complementary to arnica in traumatism. Like suppose arnica is also tried. Like you can complement arnica, you give arnica, and after that you can think of aconite. To sulfur in all cases. So aconite has got some relation to sulfur also. I have used this many times. You can give aconite followed by sulfur. He says in all cases after aconite, you can think of sulfur. Now the people who can understand miasmatic theory, they know that Sora is the background of all disease. So Sora, like in Nux Vomic also it is written in complementary. Complementary to Nux, nearly in all complaints, that is sulfur for you. So it is said in the last, aconite is acute of sulfur. So many times you give aconite, but if patient is getting better, you can think of giving sulfur as an antisoric so that his predisposition decreases, so that he doesn't land up into bigger problems. So I do this in many of my cases. Now let's open another remedy. So this is the one remedy. We talk about belladonna. What about belladonna? Again, now we know belladonna is that suddenness, hot-headed, right, congestion, throbbing. But the first question is how does belladonna get fever? Why belladonna gets fever? When you read a remedy, this is the question that should come in your mind. Let's open belladonna. The answer is very simple. Third paragraph, he says, again, great liability to take cold like aconite. That's why aconite and belladonna look very similar many times. Great liability to take cold, sensitive to drafts of air. Belladonna is also very sensitive to drafts of air, not just draft of air, but cold draft of air when exposed to cold. Especially when uncovering the head. I had read one symptom in my college that after shaving, bald or uncovering head, you think of, after shaving, fever comes or something comes, you think of belladonna. My dear friends, I could never understand this symptom. Like after shaving, fever comes, you think of belladonna. What does that mean? Haircut, like, not shaving, in the sense not shaving. You can shave your head also, like I have done right now. But haircut. You go in salon, now think about it. When you go in salon, today's salon, what happens there? It's centralized ACs, a draft are flowing. You go with your big hair and suddenly your hair is shortened. Your scalp gets affected, your scalp gets exposed to the cold air. The cold air is blowing and it suddenly goes on head. And that's how you get a disease. So it is not, according to me, it is not about haircut. It's like hair was cut. So your scalp became exposed to the cold draft and you got exposed to the draft. Maybe not AC. You got out, it was cold outside. You got a haircut, you went on a bike to home and then a lot of draft came. You came home and you got fever. That's belladonna. That's belladonna, my friend. Tonsils become inflamed after riding in cold wind. Same like aconite. So you're riding in cold wind. Exposure, belladonna. Another remedy you can think of from exposure to cold along with aconite. There's a very nice book called Nash Therapeutics. You should go and read aconite chapter. He has talked extensive about hepar sulf. Hepar sulf and aconite. These both are together, very similar. Aconite can turn into hepar, and hepar, when you're thinking aconite, how to differentiate, what are the pathophysiology. It's very nice points are given in Nash Therapeutics. If you read that, it can help you, because hepar sulf is another remedy which is used so frequently in our practice, so frequently. Okay, we come back to belladonna. Then what are other aspects of belladonna? You look at. The other aspect is you'll find redness. We all know that redness. Every complaint is with redness. So hot head, red face, and congestion. Congestion is too much. Everywhere there is congestion. So this is about belladonna. I can talk more about it, but let's go ahead. Let's talk about Bryannia. I will give a simple understanding of Bryannia. When you look up Bryannia, it is said hot weather, cold. Again, there is a relationship of cold and hot. He says patient goes, it's a hot weather, like I'm perspiring right now, I'm very hot, and suddenly I go and drink. So exactly what is written in Allen's keynote. Let's open again Allen's keynote. Let's open Allen's keynote. Right? These are the points, my dear friends, if you remember this now. your life will become so simple. And you get this cause and you have to just look for few symptoms. You don't have to keep asking, tell more, and keep repetizing, and then ultimately after end of half an hour also you are confused. It happens because we are not knowing the causative factors of the remedies. Because that's not the way we are being taught to learn Materia Medica, and this is very difficult. So when you look at here, ailments from, it is written directly, forget the mind's complaints. Complaints when warm weather sets in. Warm weather sets in after cold days. So ask yourself, when is the time when warm weather sets in and cold? So it's a time when, hot in the morning, cold in the night. That's the time of bryonia. From cold drinks and ice and hot weather, I told you that, you're playing cricket, very hot, and you took ice. Now in today also, people are going outside and they're very hot, they go home, they just don't want to wait, they will just drink ice water or sugarcane, ice full big sugarcane juice. A lot of people do that. In Mumbai, a lot of people do that. They're walking and you find sugarcane juice everywhere. And they will go and stand and say, give me one glass. And they will add more ice to it. They will not wait. And then they will take the drink and the drink. Hot weather, cold drinks taken. Sudden change in the body. Bryonia could be the remedy. Another remedy is Dalkamar. Along with this, somewhere it has to be written. Dalkamar is another remedy where you think of when this change happens. From chilling when overheated. Like Belisper is also one of the remedy. When chilling from overheated. So you are chilled. Remember the word. It is not heated or exposure to hot. It is overheated. When you are overheated and suddenly you get chilled. That is the time when bryonia comes in. From again exposure to cold air and draft and other things are there. So this is the causative modality of bryonia. Similar way you think of rust talks. Let's open rust talks. And of course, I'm not talking about the general features of bryonia because you cannot give bryonia until you see where is the mark. They are affecting. So causes, maybe the cause which I talked about, getting chilled and all those things, drinking hot, cold ice or something in hot weather. But affection is on muscles, bodies. Another remedy is bryonia. Other remedy is rust talks. Now what about rust talks? Rust talks, we all know, it is damp weather. It is exposure to, it is not about getting hot and then chilled. There, the scenario is completely different. It is exposure to draft of cold, but what? Dampness. Bathing, getting wet in rain. Bathing in summer, somewhere it is written in Ansky Road, bathing in summer. When people ask, in summer they want to go on bathing in summer means in lake. Like in villages they do that. In here also, they go in swimming pool and they are bathing. A lot of time they remain in water. We might not think of rust talks in summer weather, but it is there. Let me show you exactly where it is written. Now rust talks also has affections of bryonia, where it also acts on joints, muscles, bones. But what are the different features? PQR. Okay. First, let me show you that. You can go to the second paragraph. Ailments from spraining, straining, muscle overlifting, stretching. We all know. Damp weather, too much summer bathing in lake and river. Now I never thought of this symptom, until I read this. Too much bathing in summer. Means in summer, that's how. Now think about this. When will you get this symptom? Patient is not going to come and say, I got fever, doctor. I was bathing in summer. I was in pond. I was in swimming pool for a long time. This you will get when you understand my previous lecture where I talked about the cause, your philosophy. You know that disease is because of cause. There has to be some cause. So you will ask the patient again and again. You will ask, okay, tell me, where were you? How did it start? Before this started, where were you? When you trace it back, back, that's how you get the point. That's how you take the patient from this scenario to other scenario. When you take him to that scenario, then you get the right. I hope this is making some point. So, and after that, it is not so difficult, right? Rust talks, it has restlessness, it has joint pains, it has got too much restlessness. They can't remain in bed, tossing about in bed. They feel like, they are going to die. All those agonies and other things are there. Somebody is going to poison. So suspicious about being poisoned and killed. And Brahmania quite wants to remain, do not want to be disturbed. There's a lot of dryness, thirst. Thirst is another component in fever, especially you should ask. A lot of remedies are thirsty, some are thirstless. Brahmania is one of them, which is very thirsty. Restrox can also be thirst, but that's not important. In Brahmania there is dry, everything is dry and parched, and motion aggravates. They don't want people to come and talk. They can lie down like this. Restrox will not lie down, it will keep dancing on the bed, lying on the damp floor, aggravates. This is how things are. Now next is pulsatilla. Few remedies that I am remembering, I'm not talking in depth, but I'm just talking to you, just giving you a glimpse that more remedies when you read. This is how you have to read. Pulsatilla. If you go and look pulsatilla, what is the causative modality of pulsatilla? The first thing is menarche. You see, the patient is not better from puberty. All the problems are from puberty. Though she might have come to you with acute, but when you inquire, she will say, it keeps happening, doctor, it keeps happening. Since when it has happened? Since my puberty, since my first menses came. I'm not well. That is number one. Changing symptoms here and there. We only know that weeping causes trouble, No. Go and open boric and look at boric fever. Like suppose if I want to give a remedy for fever, I will always open boric and look for the fever chapter. Like when you open boric, pulsatilla, boric, as far as I can remember, it is said that it is chilliness. There is a lot of chilliness. They are very chill, and twilight and evening it's aggravation time. But somewhere in there it is written chill with pains, and this is the cardinal symptom of it. Chilliness is there, but pains also there, means body pain is there. So hence you get moaning with fever. So chilliness, pain, chilliness. It is said chill increases the pain, pain increases the chill. As the chill increases, as the pain increases. So patient will be chill in that fever. Chill is predominant with a lot of body pain. You can think of hypotonia at that time. But here as the chill increases, the pain is increasing. And then thirstlessness, evening aggravates. Menarche is the problem. Changing of symptom. That's how you go ahead. And of course, morning during fever. Thirstlessness. Warm aggravate. They're chilling. But warmth is very aggravation. They cannot uncover. They cannot remain uncovered. They have to cover. But once they are uncovering also, warmth is aggravation for them. And the most important part of pulsatilla, basically, I'll tell you, this I have used so many times and it has given me wonderful results. The causative modality, like yesterday, the last video I was talking about is the food. One of the causes food. Pulsatilla, fat food, gravy food, fatty food especially, ice cream, milk products, cakes, pastries. In children, first of all, you ask them, before that, where was he? Yesterday, where was you? Will get in 80% time. They will say, oh, he had gone there. There was a birthday party, or we brought a cake, we had a fatty food. You will get in history, junk food, pizzas, burger with cheese and all. If you get that, pulsatilla should be your first thing if thirstless and other symptom matches. When you talk about food also, cold drinks, drinking cold, look at arsenic. Arsenic is another remedy that you should think about. Arsenic also has more about cold drinking. Sorry, getting head wet. I just forgot to tell you. Pulsatilla is a very important remedy while getting head wet. We get head wet, we think of Delcamara, we think of Restrox, but pulsatilla is also one of the remedy from head getting wet. And then of course the other symptoms which I said follows. Arsenic. Thirst for small quantities of water. This is the number one symptom. Midnight aggravates, like second symptom. But causative modality, especially drinking cold. We think of phosphorus and other things also, but hepatic, but cold drinking. When you drink cold and throat pain happens, fever happens, arsenic should be your number one choice. The most important cardinal symptom of arsenic, which I look for, is exhaustion. Exhaustion out of proportion of the disease. Like suppose patient comes and gets fever, or suppose he has got 2 or 3 times diarrhea. His body behaves as if he's got not 2 diarrhea, he has got 20 diarrhea. He has got just fever in the morning and his body behaves as if he's been having like a typhoid fever or long lasting fever. Body is exhausted. It is out of the strength of the body. The weakness is out of proportion to the illnesses. So that's how you have to think. Ipecac, another remedy which comes out is Ipecac. Ipecac has also got exposure to cold, winter and gastric complaints. When gastric complaint comes, respiration problem comes, cold exposure is there, clean tongue and lot of nausea, continuous, constant retching and nausea. So very good remedy. Even Ipecac has also got symptoms of eating, other things like fatty food and other things. Kali Mur is another remedy which you think of when you think of pulsatilla in that comparison. Antimony crude, hot weather, like this hot weather, hot food, hot weather, summer aggravates and gastric complaint, coating of the tongue. You can think of antimony crude. Same as antimony tart in children's. Excessive irritability. Antimonies, all antimonies are excessive irritable. Cranky like chamomilla sina. Averse to touch, you cannot go and examine them. And respiration is there. Coryza is happening. Very cranky, irritable, wants to be carried on the shoulder. You think of antimony tart. So my dear friends, yeah, we can keep talking about it. Like Nux vomica, I talked about Nux vomica. Nux vomica, go and read Nux vomica. When he says sedentary life and he says that, you ask yourself, how does Nux vomica get ill? So there has to be some component of loss of sleep. There has to be some component of drinking wine, alcohol or aerated drinks. He has damaged his lifestyle, their sedentary life. This is the cause. A lot of mental stress and strain. It's a cause. Argentum nitricum, it is written, first line of Alan Skinner, it is written, long continued intellectual work. Another remedy is picric acid, where you think of, and then of course there is burning. I'm just randomly, whatever is coming in my mind, I'm just talking. So my dear friends, this talk can keep on going on, but I'm going to take pause now. I hope I have given you a gist. This lecture was not to teach you in depth Materia Medica. It was just to prepare your mind, because after this lecture I'm going to come up with cases. I'm going to show you cases after cases after cases, because until unless you see cases, you don't remember. The thought process doesn't go in your mind. And I was just preparing you for my next lectures which are coming, because this is how I practice. This is my basic. Whenever I will repertorize, I will show you what repertories I use, how simple my practice is, and what beautiful results I get in acutes. I'm so confident. I'll tell you, I'm very much confident in acutes. Anything happens in acutes, I'm the person who will stand first, and I want to take that challenge, because I know our medicines can do wonders, and I have done, with thanks to homeopathy and blessings of my teachers, I've been able to do this miracle every day in my clinic, every day. So that's what is my purpose, to show you that yes, if I can do it, you can also do it, because it is very simple. Why I want to do this videos is, number one is I want to share my experience to the world. Whoever can get it, even 1 or 2 students can get this and start getting results with this understanding. And it's not my philosophy which I am teaching my friends. I'm not teaching anything new, which is I have invented. Nothing I have invented. Everything is from the books and from the teachers that I have learned. What I do is that, only thing is, I always keep Alan Skinner and my boric, always. And always keep opening the book before I give. Even in chronic case, if I give, I keep opening the book and reading the remedy. I think that is a secret. Secret of my practice, successful practice in acutes, is this thing. And of course, the remedy relationship, other things. So thank you very much, my friends, for being patient listener. I hope this talk helps you in your practice, and you grow, and you one day come up and show your cases to the world, because sporadically a homeopath is being successful in one place will not help. In totality, people should say that if you get fever, if you get cold cough, you should go to a homeopath. That's my purpose. I want to instill that confidence first in homeopaths, and then of course it will go in patients. Thank you very much. Namaskar.